Hello guys, welcome back to Statistical Academy. Guys, though I have already covered all the things about SAS introduction, but I am receiving a few questions about statistical programming career. So I am creating a playlist in our channel named Frequently Asked Questions. So if someone reaches out to me with a doubt or question, I will be explaining it and I will be making a video on that question or doubt. Those videos will be uploaded under the playlist of Frequently Asked Questions. So here are some questions that I have received recently. First one, does the career of clinical science programming have any future? Because people are saying statistical roles in general are about to be automated. Clinical trials industries like pharmaceutical companies, CROs are continuously hiring a lot of programmers. People have been saying about this automation from decades, but clinical science programming is not going anywhere. There is no impact of automation on programming jobs. Clinical trials data is a dirty data. People should be there. SAS programming career is pretty strong and highly paid career. There is no impact of automation. What is SAS? SAS is a programming language that enables you to write programs to access, explore, prepare, and analyze data. SAS is used for statistical analysis and enables users to perform tasks such as importing data from multiple sources as well. What makes SAS unique from other programming languages like R, Python, Java, etc.? SAS programming is user friendly and easy to learn. 3000 plus life sciences companies are using SAS. Most industries that use SAS are healthcare and pharmaceutical. 100% of the Fortune 500 companies of life sciences sector are using SAS. Pharmaceuticals, medical devices, vaccines or any other healthcare companies require United States Food and Drug Administration approval to release their products to market. For that approval process, all these companies must use this SAS tool to report the data and it is mandated by FDA. They have to use this tool. In Jan 2021, SAS has announced that it has inked a deal with FDA for the next 40 years to expand its capabilities in natural language processing, artificial intelligence, and machine learning capabilities. Through the SAS VIA platform in support to the FDA mission as an essential public health agency. So I would strongly recommend you to learn SAS programming. Who all are eligible for SAS programming roles? I have already told about this. I've seen many of my colleagues who all are having different educational backgrounds like B Pharm, M Pharm, B Tech, M Tech, MSc, BSc, MBA, MCA, BDS, MBBS, BSc Nursing, Biotechnology. So I would say any science related bachelor's degree is okay. What is the average starting salary for a SAS programmer in India? Around 4 lakhs plus per annum for a fresher role. Some MNCs are even offering 5 plus lakhs. How to get started with the SAS programming? We have designed the course to learn in an easy way. First, you will learn how to access the data, how to explore the data, how to prepare and manipulate the data, how to analyze and report the data, how to export the results. And then drug development process, clinical trials, clinical research process, industry regulations, standards for clinical trials, data reporting, interviews, LinkedIn, job search, Excel, R, and many more.